Welcome back. In this video, I will discuss Trichomonas vaginalis. So, Trichomonas vaginalis is a flagellated protozoan and it is transmitted mainly through the sexual route. So, sexually transmitted infection. Incubation period for its infection is 4 to 28 days. Human genital tract, because it is an STI, so human genital tract is a reservoir. Clinical features. In case of females, there is vaginitis leading to frothy yellow-green vaginal discharge. This yellow-green vaginal discharge mostly comes in MCQs like this. So, a female presents to you with yellow-green vaginal discharge. It is Trichomonas vaginalis. There may be foul, fishy odor, but it is most typical of bacterial vaginosis. So, this foul, fishy odor is not mostly asked, but yellow-green vaginal discharge is told in the MCQs. Pruritus of your vulvae leading to itching. There may be dysuria, that is painful urination, and dyspareunia, pain during intercourse. Dyspareunia, pain during intercourse. Also, she has vaginal and cervical erythema, redness of vagina and cervix, and the cervix may appear strawberry shaped. Strawberry cervix, red strawberry cervix, because there are punctate hemorrhages on the cervix when there is Trichomonas vaginalis infection. So, strawberry cervix. It is asymptomatic in up to 50% of the female patients. In case of males, mostly it is asymptomatic, but it may present with urethritis leading to urethral discharge, dysuria, painful urination, thin whitish urethral discharge, and postcoital irritation. After sexual intercourse, patient has irritation in his urethra. Diagnosis. Mostly we check it under microscopy. So wet mount microscopy is prepared and it shows motile trichomonas. Trichomonas appears like a pear-shaped flagellated protozoa. So a pear-shaped flagellated protozoa. Pear-shaped flagellated protozoa. Culture. Also, it can be cultured in diamonds medium or similar, but it is not that much important. And antigen detection and NAAT and PCR can also be used. It is most sensitive and specific. But for you, wet mount microscopy is the most important, under which we see motile trichomonas. It is pear-shaped flagellated protozoa. Other tests are pH of the vaginal fluid. So pH of the vaginal fluid is mostly more than 4.5. So in case of slightly basic pH, it grows. Complications. There is increased risk of preterm delivery as seen with all other sexually transmitted infections. Low birth weight. HIV transmission is increased. The chances of HIV transmission are increased when she has concomitant Trichomonas vaginalis infection. So it increases HIV transmission. Pelvic inflammatory disease PID can also be seen due to this Trichomonas vaginalis, but most common is chlamydia that causes pelvic inflammatory disease. Management. Pharmacologic therapies. Pharmacologic treatment consists of, first one option is metronidazole as 2 gram orally single dose. So single 2 gram orally metronidazole can be given, or metronidazole can be given as 500 milligram orally twice daily for 7 days. Whatever is best for you. Mostly patients are compliant to this 2 gram single metronidazole dose. Alternative treatment options. If the patient cannot take metronidazole or have some problem with metronidazole, then you can go for tinidazole 2 gram orally as single dose. Tinidazole comes in 500 milligram tablets and you have to give 4 tablets of tinidazole, stat. So partner should also be managed because it is a sexually transmitted infection. So you have to treat all the sexual partners simultaneously, whether symptomatic or asymptomatic. And also you should advise that female and male partners should avoid sexual activity until they both are treated and also they both are asymptomatic. And also You should avoid alcohol when you are taking metronidazole or tenidazole, because if you are taking these two drugs, then disulfiram like reactions like facial flushing, tachycardia, etc. can occur. Patient education. Safe sexual practices, condom use, avoid douching or irritants, screen for other STIs because it increases the risk of HIV transmission. Also, other STIs like gonorrhea and chlamydia can also be seen in such females. Follow-up of the patient is also required because retest of that female should be done in 3 months for Trichomonas vaginalis because there are high chances of reinfection rate. Manage recurrence with extended metronidazole regimen, especially for 7 days as 500 milligram 500 mg BD. So this is all about Trichomonas vaginalis.